Good afternoon, everyone. I'm Dr. Natraj, Senior Consultant in PICU and ER. Hope I'm audible. And today's topic is setting up a COVID-safe pediatric practice. So we'll see what are the best we can do. I don't think there is anything called the safe pediatric OPD, but as much as possible, how to make ourselves safe and to give justice to the patients who come and visit us. So we'll see that. So if any queries or anything, you can use the chat box, and you can mute yourself till this seminar, and then you can unmute and ask questions. So we all know that COVID-19 or C19 or whatever new names we keep on giving as the day progresses is here to stay. So COVID-19 is a big problem in the major cities like Chennai, Bombay, Delhi, the places which we stay because of obvious overcrowded population. The other problems is, as you see, the number of people living in per square meter, like in Dharavi or in Royapuram area of Chennai, is too huge. Certain areas like Goa and Kerala have escaped this tide just because they don't have a big major city like us. So, but being in cities like Chennai and the government being allowed, asking us to start the OPDs, and for too long we can't keep our OPDs because Corona is here to stay. We have to take it as a new normal or adapt to new life or whatever ways or word you want to use. We have to use it, and we have to start seeing our OPD to make ourselves safe. What is the scope of this talk? In the AC era, the AC and the BCI is obviously before Corona, and AC is after Corona, which is all new terminologies, which is all coming up. So what we will see is getting our clinic ready. Getting our clinic ready is a very big ask because each clinic has different challenges. In majority of the clinic, which is maximum 100 square feet area, we might have just the doctor himself with no help around who will open the clinic, see the patient, sometimes dispense the pharmacy, you have to give the vaccinations and all those things, and close the clinic by all by himself. Or some little bit bigger clinics where you have 2-3 rooms, you can have the luxury of having a receptionist or a housekeeping IMR, those kind of rooms. So depending on each and every OPD is your own OPD setup. I think you will have to formulate rules and regulations and change your OPD dynamics to suit to the patient care. The second thing is how to restrict infection spread through asymptomatic carriers. So we'll see who is the asymptomatic carriers. As we know, the children are the biggest asymptomatic carriers, not only children, the adults who come along with them. How to ensure priority immunization, and we'll see some case scenarios. What if a walk-in patient comes in without appointment, or a sick patient comes in, and one video of the OPD which one of my friends has sent me. So what is this lockdown has actually achieved? Has it completely stopped the spread of Corona? No. So what the lockdown has achieved so far is it has given time for us to prepare for the surge cases, or so far the surge we have not seen in pediatric patients, because as for even the Chennai census in the ICH and other hospitals, out of 140 children who have admitted, 139 are asymptomatic patients. That means that's only just because the parents were positive, the kids were tested and they turned out to be positive. Only one patient was with thrombocytopenia. The other case was in child trust, which recently came in the paper also, which presented like Kawasaki-like illness, which is the private. So apart from two or three cases, majority of the children are asymptomatic. So the other thing is this lockdown has given us time to have some protocols in place. What for OPD patients, inpatient admissions, and how to go about increasing our testing centers, increasing the manpower, increasing our stocks of PPE and sanitizers. So these are the pros of what the lockdown has given us. What are the disadvantages or cons? The disadvantages is higher rates of stress, anxiety, and adjustment disorders, both in the doctor community as well as in the patient community. You can see a lot of us, some of us losing our jobs or taking a pay cut, or parents at home fighting, and there's a lot of increased stress, anxiety among them. There is disruption of the immunization services, like there is a chance that your vaccine preventable diseases can increase, but we have restarted all our immunization services, so hopefully that should not happen. And the possible second wave is after your relaxation of your lockdown, you can have a second wave of corona disease coming in. So before the lockdown, the baseline R0, that is the spread of infection, when one person is affected, he can spread up to 2.66, or some people say three adults. but the lockdown has brought this R naught to 1.5. But once this R naught lockdown is taken off, or post lockdown, the R naught can go back to 2 or 2.2. So that is what we are looking at. So a couple of things about corona disease and why we are worried. So corona is actually very, very indistinguishable from any of the respiratory illnesses, any of the viral illnesses which we see. The incubation period of corona is 5 to 14 days, which is slightly longer than the other flu-like illnesses which we see. The running nose, which is a more symptom which is more common in the influenza, flu-like illnesses rather than corona. And the mortality in corona is approximately 2 to 3%, while in flu it is only 0.1. We have vaccines and other things. And the spectrum of diseases which corona can manifest is right from your viral pneumonia to viral sepsis. You also have a lot of photos or WhatsApp videos coming about corona toes, then the Kawasaki-like illness. But the majority of them now, the theory is about the endothelial dysfunction and the endothelial associated vascular microthrombotic diseases, which is the main source of your pulmonary embolus and microthrombi in the lungs, which causes your sudden arrest situations. The main thing for us to know is the fomites which we see in our OPD clinics. So some of the fomites which we can see is the plastic like the phone, laptops, bottle and stethoscope, which the corona can stay for almost 72 hours in them, stainless steel 48 hours, cardboard 24 hours and copper vessels 4 hours. So you have to know the duration so that we take appropriate action. So the newest latest thing is about teleconsultation. Couple of slides on teleconsultation and how is it changing our trends. Since we are talking too much about restricting our OPDs, but how to get in touch with the patient, keep in touch, address their concerns, and if it's really needed, then we can call them. But teleconsultation, with already we have to charge them for whatever consultation we have to give them. We can fix the consultation charges. There are a lot of apps there, DocOn or Liberate, any apps, or even the IAP as an app. You can download the app, and once they make the payment, you can do the consultation. But some of the things which you have to keep during the teleconsultations. The main advantages of teleconsultation is it will save cost, effort and time. Patient doesn't have to come to you. The cost of travel is come down. The time taken to travel, especially in major cities, is all reduced. So they can sit at their home in their own environment and consult you. And it is good for good in times of pandemic for both the doctor and patient safety. You can clear all the doubts, doubts of the family members, including the mother-in-law and whoever is not able to come, everyone. The child usually sits in the mother's lap at home and is comfortable. The only thing you have to make sure is the time slots for the teleconsultation should be maximum 10 minutes. Otherwise, it keep on going with all the doubts, whichever they are. They'll make a list of doubts and they can ask you. The other important thing about teleconsultation is you have to make a mental triaging. You have to make sure in your mental triaging, the video whichever is provided, the time you have taken, you have to analyze if the child is sick or can be managed at home. Because you can't ask if you think the child is sick, like mild distress, or you have to examine this child, ask them to come for a personal visit and then see this child. Make sure you do all the recordings, send prescriptions via the phone or WhatsApp or mail. Make sure that you don't give any injections, because you do not know how they take the injections, the site, other things. And you have to make sure that you write that it is by teleconsultation only. And always include in the teleconsultation form, whichever you are writing, make sure that you write the warning signs or the red flag signs. And then some people do write COVID PCR SOS. And then always make sure you mention the follow-up date for these patients. In the prescription, whichever you're sending, make sure you tell the warning signs. If you're thinking it's a respiratory illness or influenza-like illness, COVID PCR SOS, and follow-up date has to be given. The disadvantages is you can't do any examination. Whatever you said and done, the examination is the most important thing. If you think examination is needed, you can call them for a follow-up. Or the other way around, if you see them in the clinic and then you feel this child has to be followed up, this child might develop URI, LRI 2 days, 3 days down the line, then you can ask them saying that you can next visit, you can do a teleconsultation, and then we'll decide whether the child needs a review or not. So prior to opening your clinic, there are a couple of things which everyone has to make sure is done. The clinic, as we know, is mild to moderate risk for any corona patient, getting corona. It's not a severe, mild to moderate risk. And who should you open the clinic? obviously you should open it. Like we have all closed our clinic, but the exit plan or when to open the clinic is not clear. Do we open when the lockdown is opened, or wait for 2 weeks post lockdown, make sure the surge is not that much and open the clinic? Is a personal choice. There is no clear identification when to open. Usually what they say is more than the whatever guidelines has come, more than 65 years of age and along with comorbid conditions, you can take your time, at least 1 or 2 weeks, and then till the post lockdown surge everything is at least stabilized, and then open your clinic. If you're symptomatic, try avoiding going to clinic for the time being. What they found is between 70 to 80 years, the case fatality rate is almost 8%. And in adult population with more than 80 years, the case fatality rate is almost 15%. So more than 65, or I would say even 70 years with comorbid, can actually take a couple of months or 3-4 months of break and then decide based on the severity of the corona. And make your own rules and regulations according to the state government, which they keep on updating along with the Ministry of Health guidelines. The most important thing is ensure you and your family members is up to date with vaccines, especially pneumococcal and influenza, because we know it is very difficult to differentiate a viral pneumonia from bacterial pneumonia, and the rate of co-infection or secondary bacterial infection is underestimated. So it's always better to vaccinate ourselves, keep up to date. And if we are more than 65 years of age, 1 dose of pneumococcal polysaccharide vaccine 23 PPSV 23 is advocated, or if we are less than 65 with comorbidities. And influenza for 0.25 ml till 36 months of age and 0.5 ml beyond 36 ml 36 months, 1 or 2 doses, and beyond 9 years of age it's a single dose 0.5 ml influenza yearly vaccine. This year's vaccine is currently available. So make sure you vaccinate yourself and your family members who are at risk with pneumococcal and influenza. The other important thing which I have to say is that ensure adequate insurance cover for your family members and the staff, the healthcare workers who come to your hospital, because in this corona times, if you get admitted at a private hospital, the cost is too much. So at least we should make sure our insurance cover is up to date. And ensure adequate sleep and rest, avoid stress, because once you are stressed, either mentally, physically, the cortisol level is too high and they down regulate your receptors already. So whenever you want your receptors to be upregulated, you might not have adequate receptors for upregulations. The major challenges with dealing with a child. So what are the challenges? So we know the children's, even in Chennai, whatever said, 140 cases, 139 are asymptomatic, more than 50%. But in Chennai, if you take, almost 95% of them are asymptomatic, but they can be super spreaders. Even if you test a child and it comes as negative, they still can be carriers and they can be spreading the disease for the caretaker they come, or for even the doctors if they visit. And there is an increased risk from the attenders who overcome, especially if they are elderly with comorbid. And the children's, they won't keep their mask, especially ideally it's advocated that less than 2 years, we don't ask them to put the mask on. Even more children's more than 2 years of age won't keep their mask on. Advising them good hand hygiene and cough etiquette is almost impossible in children's. Obviously the cough increases on seeing coming to your consultation room. They might cough directly onto you. It's totally impossible to ask them not to cough. And obviously the other important thing is for us with wearing a mask now, all of them come to a room and say, doctor, seeing your mask, the child gets terrified and is crying a lot. So we know that crying child, you increases your aerosol generation, and that increases your risk of corona. And the other thing, this is a small child where they put a mask. This child also has a mouth nipple, which is actually dangerous. So you should make sure that the child doesn't have a mouth nipple, because less than 2 years they can have difficulty and they might not be able to tell you the breathing difficulty. So the basic infection control measures which we have to take is what is called for salvation or to free ourselves from corona is social distancing, also better called as physical distancing, cough etiquette and hand hygiene. This along with proper PPE. What they say is hand washing alone, 55% you are protected. Hand washing with wearing mask is 68%. Hand washing, wearing mask, and then wearing a proper gloves, 91% of the times you can protect yourself against this viruses. So the other important about the handle with care or H is hand washing and hand sanitizers. As I've already told in the previous talk of mine, hand washing is better, especially if it's visibly soiled. And hand sanitizers, if you're not able to give adequate water and soap, you can use a lot of hand sanitizers. But make sure you have a lot of pamphlets saying it should be for 20 seconds and hair dry. And avoid touching the hands. The most important thing is avoid touching hands in near the area of the mouth, eyes and nose, because they are the portal of entry. And as much as possible, hands distance, which is 1 meter, which is from the tip of your fingers to the opposite shoulder is 1 meter. But now they have increased it to 2 meters or 6 feet. So this is actually our hospital, where we have at the entrance outside the hospital itself, we have made a respiratory clinic. Some of the hospitals have put a shamiana and all, but as you can see, we have not put a shamiana. It's an open ventilation, but we have a cover on top of it. And we have a nurse who sits there with N95 mask with very minimal papers there. That's for the screening form with a sterile bottle. And you can see the security is making sure that whoever comes, we have a wash basin at the entrance with a lot of adequate water and tissue paper here, and biomedical waste disposal, green and red bins to dispose of the tissue papers. The security makes sure that they hand wash first, then go to the nurse here. The nurse takes the adequate screening, makes sure from which area they come, including in containment zone or not, and then takes down their contact number, and we allow only one attender per patient. The rest of them actually can see behind. We have put chairs, and they sit one behind the other. It's a waiting area. So as I already said before entering, these are the things which we do: hand wash or hand rub, screening form, signages, adequate sanitizers. If it's in a clinic, you can actually make sure that the slippers are left outside, and we make sure that the clinic floor, everything is cleaned adequately. And we have to make sure of the Arogya Setu app, which the government is given. Even if we have to download the app, and it shows within 500 meters or 1 kilometer how many people are at risk. And if the patient has the app, it's better always to ask him if he has the app and to see if it's at risk or not. This is one of the signages which was downloaded from the UK website, which is children friendly, which says about the COVID-19, how to take care of them and what testing we do. This is for the children specific. And coming to a couple of slides on surgical mask as well as PPE. The surgical mask is always recommended as 3-layered mask, 3-ply mask, also called the 3-ply mask. So that is the medically fit, and it is at least make sure at least 60% of the times it will avoid the coronavirus. This is what is 3-ply or 3-layered. So this is a video on what is 3-layered. You can see the 3-layered. The outer layer is the hydrophobic. This is the inner melt layer, which is acts like a filter, and middle layer, and the inner layer is the hydrophobic. And how do you wear? The most important thing is not just wearing the surgical mask. You have to wear the surgical mask appropriately. So make sure that it covers your nostrils, both the nostrils, the mouth, and the chin, and you don't touch the front of the surgical mask once it's worn. There is two sides to the surgical mask. If it's a 3-ply mask, there are two sides. Two-ply mask always has the same color. 3-ply mask usually has a darker side and a lighter side. The darker side should always be outside. The lighter side should be towards your mouth or nostrils. And the pleats, you can see the pleats here. Just I have to discard this mask. I'm touching it to show this. This is the pleats. The pleats has to be facing downwards. All the 3 pleats is to extend the mask, and it needs to be facing downwards, and the nose clip on the top should be on top. So this is a proper way of wearing surgical mask. This is to prevent the hydrophobic properties on the inside. So if you have any secretions or anything, it absorbs. So that's the reason why it is made, and you have to wear it properly. and it should not be loosely hanging around your neck. It should not be folded, put it in your pocket and then reuse it again. So make sure once you remove the surgical mask, it has to be discarded properly in the bin. There is no added advantage of wearing double surgical mask. This is the PPE. You can either wear this complete PPE or a partial PPE or whatever it is, but you don't have it. It all depends on what clinic you have and what is comfortable for you. Just wearing a N95 mask and with all this complete PPE, you might not be able to sit for more than 20-30 minutes in your OPD. So at least we'll show you other videos of what is necessary, but this is a complete PPE. And this is a new mask which they are saying, which is equivalent to N95. It's reusable, and there's filters here which you have to discard and reuse. Use a new filter once in 15 to 20 days. Once you have breathing difficulty, you know the filter life is gone. So, and coming to the scrubs, I'll say about the scrubs, you can have a half scrubs also or a full sleeves like this. Both is okay. What they say is if you have a full scrubs, if you cough or anything, it will sit on your scrubs, and the other patient, whoever comes next after the second or third patient, might have chances of getting infected. If you are wearing a half sleeve scrub, so if you cough or if your arms and everything as a foamate, you can easily use a water and sterile water and soap and rub it off. So both of them is fine. And coming to one side of the PPE, just like a surgical mask. So the coronavirus, as we know, is 140 nanomicrons or 0.14 microns. N95, as we know, filters particles more than 0.3. So does it filter 0.14, which is less than 0.3? Yes, because the N95 has lot of molded fibers, multiple fiber layers in between, and because of the Brownian movements of the coronavirus, they get filtered in between the N95 mask, which is proven. So we can still continue to use N95, which is more than adequate to prevent in the medical setup, including aerosol generating procedures. So there are a lot of guidelines saying the pediatricians or any OPD clinic, especially the adults and all, they use surgical mask. They say more surgical mask is more than enough in the OPD settings. But I would recommend using N95 mask even in the OPD settings for two reasons. One is children's cry on seeing us. It's a aerosol generating procedures. The other thing is they can't wear a mask. Children are not able to wear a mask. For this two reasons, it's preferable that you wear a N95 mask when you sit in your OPD. And along with when you wear a full PPE, make sure that you taking coffee, tea in between, wearing N95, then putting it into the neck, taking coffee, tea, and then wearing it back. All those breaks your sterile cycle. So as much as possible, once you go to your OPD and see the first patient, wear a proper N95, wear a proper gloves, goggles, and head shield. For the next 2 hours, make sure you avoid drinking tea or coffee in between, and make sure you empty your bowel and bladder before you wear the PPE. We'll come to the next slides on how to use the N95, which is from the AIMS one and the CDC one. Coming to the gloves, they advocate nitrile gloves, which is better in preventing the entry of the coronavirus. Some people say double glove, double color. This is just to make sure if the outer one is torn, you can easily see the. Make sure that you can easily see if it is torn or not. And the outer gloves, as always, to be removed after you examine the patient. Once you examine the patient, remove the outer gloves, discard it, and wear a new gloves. So you can use the double gloves, double color, or in between patients, if you're comfortable, you can use just your sterilium bacterial rub, 20 seconds, wash all the areas, interdigital, palmar areas, and make sure that it is very clear. You can use either of them. Gloves is not compulsory, but if you use, you have to discard the outer gloves. Even a single gloves you can use, but every time you see a patient, you have to take the gloves off. That is ideal. Goggles, because we know it spreads through the mucous membrane, goggles is another important thing. Goggles or head shield is recommended, and you can wear the footwear which covers the foot fully, or shoe covers is okay. Now for the N95 mask reuse, so it has to be used by the same person. You cannot give your once used N95 mask to some other person, and you have to keep it, store it in a designated area. Always there are two tests in it. It should fit your mouth and chin. Make sure it fits you and there is no leak. How do you know no leak? When you blow your N95, you should make sure that it doesn't fog. If you are wearing a glass, it should not fog your glass, and it should balloon up a little bit. So then if you keep your fingers across, you should make sure that there is no air leak across. So there is no leak. Those kind of N95 you can use it. But if you see a COVID-19 positive patient, you have to ideally discard this mask. You can't reuse the mask again. So when you have N95, you have to take 4 sets of N95, mark them 1, 2, 3, 4. Suppose you use a mask on Monday, the next time you can use this mask will always be on Friday. So at least 96 hours you give time so that the coronavirus, whatever is there, dies off, and then reuse on day 5. So such mask can be used at least 5 masks. So if you take 4 masks, 4 into 5, 20 days, you can use this mask and then take a another new set of mask. Some people use O1, ETO, all those things. O1 is also fine, but ETO is not recommended as of now. So coming to our OPD practice as such, once you have you know what surgical gloves is, what is N95, what is proper PPE, what are the things we have to plan in our OPD. Suppose you have a 2 hours evening OPD slots. The best thing is you can have the first half for the immunization of the patients and the second half to see sick patients or a patient with fever or a cough or any other thing. So you can split your OPDs, or you can even have some days dedicated to the immunization services. Say Tuesday and Thursday, you can say is my immunization day. Tell all your patients, and only on those days you can put the immunizations. The rest of the days you can see rest of the OPs. Always encourage prayer appointments, and whenever they take a prayer appointments, if possible, ask your staff members to call them for a short history on the phone and refix the appointment time. It's for the fix for the vaccine, or if it is for the other things. And if you have a separate fever clinic, it is preferable, feasible that you have if you have enough room, you can have a separate fever clinic and see. And you can see the well baby visits at different time slots, as already said. And if your waiting time, if your room is very small, if you have space only for 2-3 people, you can actually see one patient in your cabin. Make sure only one patient sits outside. The rest of the patients, you can ask them if they come by their private vehicles, which most of the people in Chennai come. You can ask them to sit in the car and tell them the receptionist will call them once their turn comes. And once the patient goes out from the cabin, then the next one goes in. Some people take this consent and declaration saying that form saying that even if you can be at corona risk, and coming to a clinic also can cause a risk of corona. And just because if you get corona after visiting a clinic, you can't blame the clinic. So this is not actually legally valid. It will not stand in the court of law because this is negligence. But so as far as if you are diligently doing your proper PPE, giving them adequate sanitizers and tissues, and maintaining social distancing, that is more than enough in any clinic, and it is valid in court. Taking a consent, just saying that they can get corona if they visit you and it's not a responsibility, is actually not legally valid. The other thing is make sure the caretaker, everyone wears a mask, and we prefer surgical mask for people who come to the clinics. Going outside, cloth mask is fine, but if they're coming for a hospital, it's preferable that they wear a surgical mask and come. Arrange enough of hand washing and sanitizers before they come. And the other thing is about rooms. Make sure that the waiting room is well ventilated, and there should be no chairs or minimal chairs. So make sure that you remove half your chair, furnitures, toys, reading material, whatever you have. Minimal chairs, or some clinics make them wait one of them and then see and send. And make sure a distance of at least 2 meters, that is 6 feet distance, is maintained. So this is a clinic actually. This is the OPD in Rainbow. This is, I've taken it as a 2 photos. In this photo, you can see the minimal things which is kept in the desk. This is a stethoscope with a reception prescription pad, the pen, the sterilium, the torch, the computer, and the prescription printout. And this is the examination couch. The X-ray machine is on the top. The bottom photo shows that the examination couch, where we have the disposable sheets there, and you can see the wash area here, and the red disposable bin there. So this is the area which you can manage, and you make sure that the seating area for the patient is actually without the armchairs, lesser number of foam-at contact points. That's all. This is another this is actually a clinic of my friend, where again he has the same thing, very minimal thing on your desk, a stethoscope, and if you have a infrared thermometer, good, and a chair, and this is how he's sitting in his clinic. minimal furnitures. So a couple of points on the ventilation. So we have to actually go back to our good old days where we didn't have the AC. It is preferable that we see in open ventilation as much as possible. We have to have a cross ventilation. That is, if you have a window and door, make sure that you open the window and door, allow movement of air across your rooms. So the moment the cross ventilation increase your cycle. Just we say like negative pressure room where the cycles is 12 cycles of air exchanges. When you open your windows and your room, you almost have 7 to 8 air exchanges cycles, which is good enough, which is the best you can do in your OPD. Suppose you are used to AC and you want to on your AC, the AC temperature should be kept between 24 to 28 and the humidity of the AC should be 40 to 70 degrees. The ideal for the coronavirus is actually humidity of 80 where they found the coronavirus dies off, but at humidity of 80 we get a lot of dust allergy and increased risk of wheezing, asthma and all those things. So we try to maintain between 40 to 70, and below 70 there is increased risk of your bacterial and viral proliferations. The direction of the AC, it is preferable that the AC is located behind you, so that it comes from behind you and towards the patient, so that whenever the patient talks or coughs, the AC will prevent the forward spread of the coronaviruses. And if you have a clinic where your window, you can keep your window in between the patient and yourself, it is best, so that you can open the window and allow a fresh gush of air across you and the patient. So these are the few things you can do. The other thing is, if you don't have AC, as I said, keep the windows and doors open, and you can also have a exhaust fan so that it sucks out little bit of air and you can mimic a negative pressure room in your AC as much as possible. And to decrease the risk of fomate, use only one pen, phones or bottles, avoid watches, no rings or dangling earrings, and use scrubs, either full sleeves or half sleeves. And the other important thing is, everything is contaminated unless it's cleared in your presence. So make sure that you either clean your desk, doorknob, computer, workstation yourself or in your presence. So coming to what you should do in your clinic and what not. So limitations: limit your routine weight check. Use approximate weights. Suppose you have seen the patient even in the last 6 months, that is fine. You wouldn't have gained more than 1.5 kgs to 2 kgs. So use approximate weight. Try avoiding head circumference and height, especially if you have seen him recently in the last 1 or 2 months and it's an older child, nothing much changes after that, after a couple of years. Limit use of tables. Some patients, if you want, you can actually directly ask them to go sit in the examination couch directly instead of sitting next to you. From the examination couch and from your sitting place itself, you can ask a short history and then examine him in the examination couch and send him off. You don't have to use a table as such. The other thing is limit use of stethoscope. We have to use stethoscope wherever it is necessary. But if you have recently examined him or it's your usual patient, you know the patient very well, you don't have to use the stethoscope just for the sake of a cardiac auscultation or the completion of the systemic say. Try to avoid ENT examination unless it's needed. Recently, I saw a patient in the OPD who came with one-sided submandibular lymphadenopathy for the past 3 to 4 weeks, and he was on 3rd course of antibiotic after video consultation. One course was given by one doctor, the other doctor prescribed the 2nd course. So when he came, you have no other choice because it's a unilateral lymphadenopathy and it's almost in his 3rd course of antibiotics. So when I opened his mouth, there is huge dental caries sitting there, couple of dental caries, which was a source of infection. And once it was removed, and the dentist actually preferred to remove it under GA because of the risk of the aerosol generation. Once it was removed, it settled. So wherever it is needed, especially, definitely do the ENT examination. Try to avoid if it's really not needed. Don't give any nebulization unless the child is desaturating. You can to use the oxygen and give nebulizations. Otherwise, as much as possible, use the MDI even in your clinic. If the patient is coming to you for the first time and he has a huge list of documents with him, all the MRI and CT scan, maybe you can ask for a soft copy and to ask him to send it beforehand so that you can see all the soft copy in your WhatsApp. You can even save the time. This is to limit the time of exposure with the patient and touching all his documents. If you have a lift in your clinic going first, so you have to try avoiding the lift, go by the staircase. Limit the number of patients which you see. Give appointments every 15 minutes. That is maximum 4 appointments in an hour. That way you can space out your patients. Even if you give appointment at 6:15, patient usually will come either 15 minutes early or 15 minutes late. So you have to be prepared for that. The other important thing is limit your time exposure per patient, like maximum 10 minutes you can limit yourself. And if you're preparing a vaccine, ask a receptionist or a nurse, teach them how to prepare a vaccine, or tell the patient to wait outside, prepare the vaccine, then call them inside. So otherwise what happens is your time duration or the interaction with the patient time goes a lot. Limit the toys and reading material in your waiting rooms, including your consultation rooms. Some patient who comes for vaccination, if they come for vaccination and then they feel that the babies will feel post vaccination will feed the baby and then go home, tell them this is not the time. They can go home, 5-10 minutes is not a big difference. They can go home and actually feed the baby rather than sitting in the clinic and then increasing the patient load, all those things. They can actually go home and feed the baby. In certain things you have to be generous, like disinfecting after each patient visit. Make sure that you have 2.5% Lysol, and including these tools which the patient has used, you have to disinfect your desk and everything. 20 seconds clean quick disinfections. If you're using a sheet for the examination couch, change the sheet, paper sheet, and make sure that you give all your housekeeping to proper PPEs. And if you have a TV, you can use the TV instead of the pamphlets and other things to spread the awareness. And before leaving the clinic, make sure that you document all the patient visits, like their addresses including the possible diagnosis, just to make sure in case they turn out positive, you can have a contact tracing. Leave all your stethoscope, neomas, apron, and some people say cash also. It depends. If you're so paranoid about the cash currency having corona and it's a fomite, you can leave them in your clinic for 3 to 4 days, and after the 4th day, once you know by 3-4 days the corona dies off, you can take the cash, like Monday's cash you can take on Friday and go. Decontaminate the entire clinic with 1% sodium hypochlorite solutions. And before you go home, DTH is direct to home. Don't do multiple clinic visits or hospital visits, and you have to go directly to home and make sure whatever scrubs, everything is there is discarded, and you take a good wash, head bath. So coming to the scenarios, couple of scenarios. So if they come for a routine vaccination, immunization in your clinic, so as usual, make sure that you do the screening, confirm the appointment time. The encourage bill payments through the Google Pay or whatever digital pay they can do. If not, take cash. See them if you have a dedicated days of vaccinations, like Tuesday or Thursday, Monday, Wednesday. See them during that time, or the first half of your clinic. Make sure the receptionist or nurse is preparing the vaccine while you take a short history. Avoid detailed weaning, like weaning diet advice. Ask them to prepare a weaning diet and send them through the WhatsApp. And then always explain about the warning signs post-vaccination. Advise about pneumococcal influenza if they have not already taken. If they come walk-in without any appointments, then always it's preferable to have a board in a clinic or a pamphlet saying next time always take a appointment before, request an appointment before coming in. If you're already seeing a patient, ask them to wait either in the waiting room or in the car, and once you have finished seeing the patient, you can actually ask them to come in and see. And if there's a walk-in patient, it's a first time patient is coming, you have no idea where the patient is coming, or if they're coming from a containment zone, make use of the Arogya Setu app if you have. Make it a point to ask them if they have the app and show them if they are at risk. Or you can actually download the Arogya, one of the receptionists can download the app and it will show you whoever is at risk. That is the least we can do. And if they are having fever, travel history, or they're coming from containment zone, if they're stable, you can see them if you have a separate fever clinic or refer them. Any other visits, make it a quick consultation and send them. If the patient is coming to you, all fever, cough and cold is corona unless proved otherwise, because there is no way to distinguish different types of fever. If the patient, make sure that the patient is healthy. If the patient is sick, obviously you will not be able to handle them in the clinic. You have to refer them to the nearest government hospital or a COVID center where they handle kids. If you see a focus, like if it's a tooth, infected tooth, or there's a pustule and the child has symptoms, then it's obviously non-corona. It's probably a bacterial infection, so you can treat this patient. Or the other signs of sickness is your tachypnea or the COVID rash, erythema, eye spiking fevers, all those things. If you're suspecting, it's better to send off them to the nearest COVID centers. Or if you see them, if they look like your common cold, URI, or you want to have a revisit with them, make sure that you ask them for a revisit, but you can use teleconsultation the next time, and then ask them to come back if you really want a repeat examination. This is one of the clinic of my friend. It is a little bit long video, but it's a very nice video which is taken in his own clinic. He actually has 3 rooms, I believe. So we can run the video and see what is done. If the I think the audio is not audible, so I might I'll tell you what it is. This is the entrance to his clinic, and this is what he's saying is this is his outside road where they can ask the people to park the cars and wait. You can see there is 2 entrances here. He has put marked number 2 as the for the waiting area there. I'm sorry, the video is taking. I think we'll run the video and then we'll discuss. This is the washing area and the toilet for the patient, which is showing. So this is the toilet area and the wash station before they enter. So what is done is actually made it, please do not touch anything. These are the pamphlets which he has. One attender. On the waiting room, you can see the receptionist there. That is the reception desk. You can see where is marked as patient 2. For the 3rd patient is actually made them waiting in the whatever breastfeeding room he had. That is converted into waiting room number 3 if the patient 3rd comes. This is for the 4th patient if they come. This is having the is encouraging the Google Pay digital payment. Minimum furniture, only 2 chairs is put. So this is what is wearing the surgical mask. He is wearing a face shield here. This is the face shield which he has, and he is wearing the gloves as well. And he has minimum things on his desk like prescription pad, stethoscope, pen, infrared thermometer, pen, infrared thermometer. He has a sterilium, drinking water, and He just has the ORS, which he feels it's very important, which I also feel has to be given for description of the patients. He doesn't use the AC, that is what he's saying, and there is a window which is kept across, which is in between the patient and the consultation. He is using a disposable sheet there for each patient. This is got in disinfected wash basin, everything next to the patient area. And this is what is using as a bleach, the sodium hypochlorite solution, which can be prepared. 1 scoop in 1 liter before he goes off. So that was about the video. It was actually my friend's OPD which he has, and is shown clearly what can be done. But each OPD is different. You have to modify according to the OPD you have. And finally, about the summary, every epidemic or the pandemic is a great teacher. You have to always be positive, at least hope not COVID positive. Be updated about what is happening. All the respiratory illnesses like pneumonia has to be managed as per the guidelines, and make sure that you'll be able to recognize what is COVID and non-COVID, stabilize and send them. But I think if you follow a proper hand washing, social distancing, cough etiquette along with your proper PPE, you can run a safe clinic. The more major important thing is we have to unlearn whatever you have learned. Make sure that it is a habit, it forms a habit for us, and there is no role for any heroism. If you do all this, your patients will appreciate and your staff will appreciate your efforts. Thank you. Now, if you have any questions or queries, we can go through them.
What age we can advise a mask for the kids?
Usually, more than 2 years, they'll be able to put a proper mask, ma'am. Less than 2 years, I don't think the kids will keep the mask on also. And less than 2 years, they might not be able to tell you if there is a respiratory distress or it's suffocating for them. So ideally advisable is more than 2 years of age. If the kids are able to wear the mask, that should be fine.
Just the cloth mask will do, or we have to have the 3-layer mask?
If they're coming to OPD practice, it's ideal that we advise them 3-layered mask, because we have to make sure that we are also safe and they are also safe. It's a general place they are going. If they're going for a market or outside, if they're going, then a cloth mask is fine. But if they come with a cloth mask also, that is fine. But it is advisable that they wear a three-ply mask if they're coming to hospital or clinic.
Thank you.
Thank you, ma'am. Someone has asked, should they change their mask when they enter hospitals? Ideally, once you wear a mask, if you have not removed a mask or not taken the mask, folded it, and all those things, there is no need of changing a mask when you come to the hospital. The same mask will suffice. They make sure that you don't adjust the general tendency of anyone is at least 23 to 24 times in an hour, we tend to take our hands near our nose, ears and mouth and try to adjust our mask, because it's a new normal for us. We are not used to it. But if you're not doing all those things, there is no need to change your mask once you go to the hospital. Again, the question is whether we have to ask them for a hand wash or use hand sanitizers. The best thing is actually hand wash. If you have if you're able to provide them with good amount of water and soap solution, that is more than sufficient. It will do, because if your hands is soiled, your hand sanitizer is of no help. So we do not know if the patient comes from his car where it's soiled or not, or what the kids are wearing. So it's always better and preferable if they do a hand wash. But in clinics where you're not able to provide them wash basin like outside, you have to create one, or there is no space, the next best option is hand sanitizers. Hand sanitizers will again increase your cost of the clinic and other things. Hand wash is a simple and age-old method which is easier done. Someone is asked for specific suggestions for nebulizations. I think nebulization is actually, it depends on what it is. If the patient is a well-controlled asthma and it's a routine, you just think it's little bit increase in his regular wheezing, other things, you can try with MDI with a spacer, always with a spacer and face mask. But if you have no other go, or you think is desaturating, if you have a pulse ox at near OPD and you feel is like saturation is less than 92 and you have to give him with oxygen, it's always preferable that you refer to a place which has a negative pressure room where you can do a, or switch off your, or if you have to identify a room, which is well ventilated, switch off all the ACs in that room and give the nebulization. And once the nebulization is given and the patient goes off, the whatever aerosol particles is generated, it takes 20 minutes for those particles to settle down. So wait for 20 minutes in that room. Post 20 minutes, make sure that you decontaminate that room properly. If you have the luxury of admitting in your hospital with a negative pressure room, that is most ideal. But in clinic, if you have no choice or if the child is very sick, you have to nebulize. Make sure you can identify a room, as I said, where all the ACs and everything is off, cross ventilation is available. Nebulize. After 20 minutes, completely that room has to be decontaminated with 1% sodium hypochlorite solution and left open for next 3 to 4 hours unused. Someone is asked
how do you prepare this 1%? How do you prepare this 1% sodium hypochlorite solution?
It is available the percentages. You take 1 gram, 1 scoop of sodium hypochlorite bleach, that is 28.4 grams of bleach, and mix it with 1 liter of water. That's all it takes. Bleach is very easily available and cheaper option. So you put 1 scoop of bleach in 1 liter, and that makes 1% sodium hypochlorite solution, which you can discard also if remaining is.
This we have to spray in the room. Is it after nebulization you have to spray it in the room?
After nebulization, all the areas, like if suppose is use this tool or the examination couch, everything, or the high risk areas like your handle, everything has to be cleaned with 1% sodium chloride solutions. That is after 20 minutes of using that room, and it should be a separate room. You can't nebulize in room in which, as much as possible, avoid nebulization is the best strategy. But if you think is desaturating and you can't wait till he goes to the hospital, and if you're using a separate room, the best is avoid using the rooms. Use sodium hypochlorite solution 1% for all the areas, including the floor, the wall, the high touch areas like your door, handles, windows, everything, and then avoid using that room for the next 4 to 6 hours. Someone has asked how many attenders can be allowed with each patient. I think the ideal thing is 1 attender, but the pediatrics, most of the times they might, if you are having a twin baby who comes into the hospital, they might have 2 attenders to take care of both the children. Those special scenarios, you can allow 2 attenders, but as much as possible, 1 attender is more than. Someone is asking, can AC be used in the OPD and scan room? I think the scan room definitely needs the OPD because the scan machine has to be kept in a temperature which is cooler temperature, otherwise the machine will get heated up. And so the AC is a must in scan room. But if you're using in, that's why the recommendation in the scan room is you use a proper N95 mask, fit, and there is no leak in the N95 mask. Always wear a gloves, and make sure the patient also uses a surgical mask, and make sure the scan duration is at least less than 15 minutes as possible, and that's the maximum you can do in the scan room. Okay, thank you. That was it. Thanks for joining us for this session. The next session will be on Thursday, coming Thursday. Thank you.